Doctors at the Children's Hospital in Macon are performing a groundbreaking surgery. They're the only ones in Georgia using the Pediatric Robotic surgery system.
41 NBC's Melissa Lee got inside the OR to show us how this state-of-the-art technology is helping some of the hospital's most fragile patients.
The beauty of it is that you're not really learning new operations. You're doing the same operation you were doing before. You're just using new technology, a different machine.
Dr. Josh Glenn with the Children's Hospital at the Medical Center of Central Georgia does something that no one else in the state of Georgia is doing. He's using a robot to perform surgeries on children.
We are fairly early adopters of this technology. There's only about 13 active centers in the country who are really every day doing pediatric robotic surgery, and we're one of those 13.
While the patient is on the operating table, Dr. Glenn sits at a console several feet away.
I'm not craning, over a patient, so ergonomically it's much easier for the surgeon.
Using hand and foot controls and a viewfinder, he's able to see a 3D image that puts him right next to the area of operation. The system allows for better visualization, more precision, and more control during an operation. All things that 12-year-old Corey Norton and her family are very thankful for.
Gastro-diverticulitis, it was at the top of her stomach where her esophagus goes in. It's very rare.
I had kind of like a balloon in my stomach and they had to remove it.
Something that no one near their hometown of Cairo had seen before.
We were referred here the next day.
3 days after a 6-hour surgery, Corey wasted no time getting up and walking around.
I feel better than I did after surgery. It doesn't hurt a lot.
Benefit, less pain, fewer stitches, and a faster recovery.
So by using the robot, we were, one, able to do it minimally invasively through small incisions, not having to do a big open operation on a young lady who's wants to wear a bathing suit and wants to take her go to the beach and not have a bunch of scars.
It's technology put in the hands of an expert to best care for their patient.
As long as they can fix my daughter, I'm good with it.
In Macon, Melissa Lee, 41 NBC News.
Dr. Glenn tells us the technology can be used for the smallest baby to adult-sized teens. The medical center is the only institute in the state performing those kinds of surgeries, with the first of its kind being performed last June. They've used the technology about 40 times since then.